Okay, hello everyone. How's everybody doing? Hope you're all well and happy and healthy. I don't know, awkward. All right, let me continue with the news. Let me talk about adaptive biotechnologies. This is the company I really like. I followed for a long time. Uh, Not that long. I don't know, whatever. But ticker's ADPT. I just made a video about them like a week ago concerning some news, and I just want to read you some more news concerning the company because I really like the company and I want you all to be aware of it as well. And they have earnings in 4 days as well, and they are expected to beat earnings, so we'll see how that goes. But let me read you the news. Adaptive, a commercial stage biotechnology company that aims to translate the genetics of the adaptive immune system into clinical products to diagnose and treat disease, today announced that Palmetto GBA, a Medicare administrative contractor that assesses diagnostic technologies through its MOIDX program, has expanded coverage of the Clono SEQ assay to include monitoring minimal residual disease in Medicare patients with diffuse large B-cell lymphoma, the most common type of non-Hodgkin lymphoma. This coverage determination is the first for Clono SEQ to include the assessment of MRD based on circulating tumor DNA fragments of DNA released into the blood from lysed cancer cells. MRD refers to the remaining number of cancer cells that may be present in a patient's body during and after treatment, and that may eventually lead to recurrence of the disease. MRD testing is a simple blood test performed at multiple time points throughout a patient's cancer journey to assess prognosis, determine response to treatment, detect relapse, and inform care. MRD assessment in DLBCL utilizes ctDNA measured in peripheral blood to give oncologists a better understanding of which patients are at high risk for recurrence and provide them with information to create a more precise treatment plan for each patient. We've advanced therapy for large B-cell lymphomas significantly in recent years. However, a considerable unmet need for highly specific, precise monitoring of disease progression during and after treatment remains, said Frederick Locke, MD, Chair, Department of Blood and Marrow Transplant and Cellular Immunotherapy, Moffitt Cancer Center. Measurement of ctDNA to access MRD provides additional information that can complement or improve upon insights from imaging that can help inform clinical management. The updated coverage policy expands DLBCL patient access to Clono SEQ MRD testing, as approximately 75% of actively treated DLBCL patients are Medicare aged. The policy is effective immediately and extends to all DLBCL patients, regardless of line of therapy, treatment regimen, or testing time point. Clono SEQ testing for DLBCL patients is currently available for clinical use as a laboratory-developed test performed at Adaptive's CLIA certified lab in Seattle, Washington. Clono SEQ ctDNA-based MRD testing in DLBCL has also been approved by New York State's Clinical Laboratory Evaluation Program. We believe Clono SEQ raises the bar for disease monitoring in DLBCL patients. Recent studies have shown that MRD assessments with Clono SEQ early post-CAR T treatment can be more informative than PET-CT in identifying patients who are at high risk for relapse, said Nitin Sood, Chief Commercial Officer, MRD Adaptive Biotechnologies. The Medicare coverage decision provides greater access to Clono SEQ and acknowledges the mounting evidence for implementing routine Clono SEQ MRD assessments in DLBCL. The coverage expansion adds to existing Medicare coverage for clonoSEQ in multiple myeloma, chronic lymphocytic leukemia, and B-cell acute lymphoblastic leukemia. Medicare coverage for clonoSEQ in these indications is aligned with clinical practice guidelines, which support assessing MRD at multiple time points throughout therapy to monitor treatment response and help predict patient outcomes. The clonoSEQ assay is the first and only FDA-cleared in vitro diagnostic test service to detect minimal residual disease in bone marrow from patients with multiple myeloma or B-cell acute lymphoblastic leukemia, and blood or bone marrow from patients with chronic lymphocytic leukemia. MRD refers to the small amount of cancer cells that can stay in the body during and after treatment. So look out for Adaptive. This is going to be a really disruptive company in the industry, especially since they teamed up with Microsoft. That's huge. So just keep up with this company. I just want to keep you all updated, and that's about it. So have a great weekend, everybody. All right, take care.